Yeah, so it's CRP, C-reactive protein, and it's an acute phase protein, something that we see and use a lot in A&E, testing for like inflammation and infection, and it's raised generally if you've had a heart attack. The main component we test for is something called troponin, which is released by the heart muscle once you've had like any kind of damage to the heart muscle. And the thing is, this level raises after a while. So if anyone's suspected of a heart attack or any heart problems, when we bring them to A&E, we take the test, and then we have to wait for a couple of hours, at least 4 hours after they present and say they've had this kind of heart trouble or pain, and we test again to see a raise in this. However, with a number of people in the population, they can have silent heart attacks, which is what I think your mother may have had. Yeah, and this is quite common with elderly people, women and diabetics, where you might actually not have the crushing, chest pain and the palpitations and the sweating and difficulty breathing, and you may not actually know you've had a heart attack. But using this CRP, we can test the blood and see exactly what you've had.
Yeah, see, look, this is an issue close to my heart, forgive the pun, because my mum had a series of heart attacks last year. Actually, it was her anniversary yesterday, a year since her first major heart attack, and she had exactly that. She didn't have the classic sort of collapse to the floor, clutching her chest like you see in the movies. She had dizziness combined with heartburn, and she thought she had indigestion, to be honest. But she kept trying to... Oh, there's my mum, bless her, on the... She'll be so embarrassed.
She's going to love this.
So she went into A&E and had to wait for those troponin levels to come back. Right. So is this blood test then going to be quicker so that traumatic wait really...
It's not generally going to be quicker. Okay. We do it at the same time as troponin. However, CRP is a test where you... And the thing is, CRP, like troponin, takes a while to raise. Usually CRP will be highest even days after the actual event. However, people with a generally raised CRP in general, normally under 2 is the general level. Your CRP shouldn't be raised. But if it's like 10 to 15 on a general level, this could sense the fact that you have some information and could predict an acute cardiac event such as myocardial infarction, aka a heart attack.
Why are diabetics more prone to having silent heart attacks?
I'm not exactly sure. So with diabetics, there's a lot of organ failure that happens with diabetes, and a lot happens with the arteries. The coronary arteries, the arteries that supply the heart, those are the ones that get blocked, which cause the heart attack. Obviously, having diabetes or being obese or having ischemic heart disease or coronary heart disease, this raises the risk of potentially having a heart attack. Silent heart attacks, obviously the ones that don't present the typical symptoms, we're not exactly sure why diabetics have these or women or elderly people, however it happens. And that's why I do urge people when they have a funny turn and whatnot, or you've had a grandparent who's had an event, this could be a heart attack, and that's why we always check. For people who've come in A&E, we don't exactly know why.
And you are an A&E doctor. I mean, this is what you see day in, day out. It makes me feel so grateful to doctors like you saving my mum's life. But, there are people then, through this, another news story out today, there's this blood test that can show that you're at risk of a fatal heart attack within the next 3 years, and that would stop you seeing so many patients. Yeah,
that is the CRP, but I think there are a number of different factors that go into it. A number of different factors that go into your risk. Obviously, I mentioned your risk for cardiovascular disease is based on age, it's based on your weight, based on your family history, any hereditary conditions. However, it's like one of these things that's very, very difficult to predict, but we do have people in high-risk groups, and those are people who are seen in the community by the GPs and started sometimes on medication. So if you have high blood pressure, if you have high cholesterol, if you have diabetes, these are people who we're going to put on medication prophylactically to prevent a cardiac event such as heart attack.
Yeah.
Clever stuff.
Is your mum watching now, do you think?
Yeah, she is.
Mrs. Webster, I have to say to you that you should have done, and I'm glad you're better, but you should have done more housework. You should have gotten this. You should have done more washing up, more hoovering, and more cooking.
She'll laugh because she hates housework.
I know. So I read that the study showing that, a moderate amount of housework can obviously reduce your cardiovascular risk.
It's just good exercise, right?
It's generally good exercise. And the thing is, this study, I looked at it, and it was only done with women. So it is...
That's very sexist.
Which, by the way, for the record, housework does not exclusively need to be done by women.
I do a lot of housework myself.
Good man, good man.
I do a lot of housework myself. However, it's just basically saying a little bit of moderate kind of movement and cardiovascular exercise is going to be beneficial in the long term. That's basically all it's saying.
Okay.
As in, the headline, is catchy, cooking and cleaning. It's going to save you, but it's generally just movement.
No, I think it gives me a good workout.
Yeah, I mean, 4 hours of daily life movement, which is a nice way of looking at it.
Exactly,
Just
daily life movement.
Just getting up and about and doing a few bits.
Getting up and down the stairs, getting up and about,
walking
gardening,
to and from the fridge.
walking the dog, whichever.
Yeah, allowed to.
You don't need to go ahead and cook and clean.
For your cool water or whatever healthy drink it might be. Right, sticking with the heart theme, there's been some new research, this is in The Sun in Scotland today, that shows what happens to the heart just before we die. Well, there's a man who was having a heart attack to the brain, He was having a heart attack and they inadvertently measured what happens to the brain. Yeah,
so obviously we know that the brain goes through a number of different, what we call waves. And then there are a number of different waves, and we've studied the brain in terms of what happens to the brain when you sleep, when you're awake, when you're excited, when you're in love, through a number of different things. And here, obviously, they've said that there are a number of different things that happen just before you die, potentially picturing that you could have an event where you almost have a flash of your whole life 30 seconds before your heart stops.
Obviously, now that is interesting, is it? Because it's been the sort of the old wives' tale or whatever that,
life flashes before your eyes.
Flashes before your eyes. Well, it's true.
It's a very difficult thing to study because obviously you're going to have to look at people right before they die. You can never really predict exactly when somebody's heart will stop and they'll die. Plus, as an A&E doctor, most of the time when your heart stops, we try and start it again.
Yeah.
In the event that you have a DNA CPR and you're possibly suffering from a chronic illness and we know that your time is coming and we know that your heart will stop, etc., and we won't try and bring you back, then you may look at these people, and if they put themselves forward, we can look at their brains and what they actually see. But the thing is, nobody's going to come back and tell you, so you're never going to really know.
Although,
this is just an isolated event.
Lots of people who've had near-death experiences have reported that, haven't they? It's just obviously not being measured. People who've been in car crashes, sort of watching themselves from a sort of...
But it's hard to say what people actually imagine exactly what happens. People say they've been to heaven and hell and experienced loads of stuff after death and been brought back. It's kind of hard to say what the body and the brain will experience. What we do know is the brain is a very, very complex structure, the most complex organ we have. We do know it goes through a number of changes while we're sleeping, while we're dreaming, during different phases and stages of sleep and dreaming, and while we experience different emotions. So it wouldn't surprise me that just before when we pass, the brain would go through some emotions where we actually...
But it's interesting, if you sort of view it like a computer, it does almost seem to have a specific shutdown sequence then.
Mechanism, like a Microsoft.
But also there's all the questions, I mean, we're getting deep now, but sort of spirituality questions. I mean, when I think about an A&E hospital where you are seeing more people on the brink of life than probably anywhere else. And it's sort of all these people who report these out-of-body experiences and lots of people who go on to somewhere else, or maybe not.
It's very difficult because obviously a lot of people in the viewers won't have seen people just before they've died. I've seen a number of people just before they pass, unfortunately. And a lot of the time they're to the point where they can barely say anything to you, but you can see, and any doctor will tell you, you can see and you know kind of when it's coming. And you know when people are going to take
goosebumps.
you know when people are going to take their last breaths, and especially because they have a certain breathing pattern.
The death
regular
rattle.
breathing pattern, the death rattle. And you can almost see it, and there's nothing you can really do to like mimic that kind of picture, because you can almost see when someone looks at you and you're the last person they're going to see.
Dr. Emeka.
Yeah.
No, it's fascinating.
Is it quite peaceful?
Though.
Tell us it's a peaceful moment in most instances. I mean, obviously you see trauma.
Obviously, in the emergency department, we don't want people to pass away. Like, we're not a hospital, a long-term ward. We don't want people to pass away. However, there's certain things, especially when, an elderly person's come in and they've had something like a AAA, an aortic aneurysm rupture. We know pretty much there's nothing we can do in a lot of the circumstances. We've spoken to them. The first thing we do is we let them know, we call the families, get everyone in, because we know pretty much it's a ticking time bomb, especially if we can't repair it. And when you see them and they look at you, it's almost like you just want to make sure they're in as much comfort as possible. At that point, your aim as a doctor isn't to revive them, it's not to save them, it's more a comfort treatment.
And that's a dignified end of life.
Yeah, a dignified end of life.
Yeah.
And I think that's probably when they go through these phases, because you're going to be in a situation where, imagine, you're thinking, this is it. So what are you going to do? You're going to remember everything from beginning to end.
Yeah, I think it's fascinating. But you see, for one, I'm not frightened of death. I think a lot of people...
Neither am I, funny enough.
Yeah,
I think maybe because I've become so accustomed to it.
Yeah.
And as a doctor, one of the things we learn in medical school is we pronounce people dead, and you learn how to pronounce people dead and how to know when someone is actually dead. Some doctors have made the mistake of pronouncing people dead who aren't.
Gosh.
Let's not go there.
And so because of that, we're very, very aware of the signs to look out for signs of life. And I think because I've seen it, I've seen people live, I've seen people die, I'm kind of not afraid.
You're
It's almost like a
resigned to it.
natural,
Well, it is.
natural
Well,
end.